Gland. A gland is a group of cells in an animal's body that synthesizes substances such as hormones for release into the bloodstream, endocrine gland, or into cavities inside the body or its outer surface, exocrine gland, duct gland. Endocrine system. Endocrine system. The endocrine system is made up of the glands that produce and secrete hormones, chemical substances produced in the body that regulate the activity of cells or organs. These hormones regulate the body's growth, metabolism, the physical and chemical processes of the body, sexual development, reproduction, mood, and many other functions. Major endocrine glands. It includes the following endocrine glands. First, thyroid gland. The thyroid gland lies in the front of the human neck in a position just below Adam's apple. It is made up of two lobes. These two lobes are joined by a small bridge of thyroid tissue called the isthmus. The thyroid makes three hormones that it secretes. The thyroid makes three hormones that it secretes into the bloodstream. These two thyroid hormones, thyroxine T4 and triiodothyronine T3 and calcitonin. In the cells and tissues of the body, the T4 is converted to T3. The T3 is biologically active and influences the activity of all the cells and tissues of the body. T3 and T4 are partially composed of iodine. A deficiency of iodine leads to decreased production of T3 and T4. The thyroid hormones primarily influence the metabolic rate and protein synthesis. These hormones also regulate viral body functions, including differentiation, breathing, heart rate, body temperature, central and peripheral nervous system. Calcitonin plays a role in calcium homeostasis. It lowers the level of calcium and phosphate in the blood and promotes the formation of bones. Disorders of thyroid hormone. Thus, hyposecretion, hypothyroidism. Following disorders occurs in case of insufficient production or hyposecretion of thyroxine hormone. First, cretinism. Physical and mental growth of the child is retarded. Second, myxodema. Myxodema is used to describe the skin. Myxodema is used to describe skin changes in someone as swelling of the face, which can include lips, eyelids, and tongue. Swelling and thickening of skin anywhere on the body, especially in lower legs. Third, goiter. An abnormal enlargement of thyroid gland. The most common cause of goiter is lack of iodine in diet. Goiter is commonly in hilly area because of iodine deficiency in water. Fourth, Hashimoto disease. Hashimoto disease is a condition in which the immune system attacks thyroid, resulting in its complete loss. It is also known as the suicide of thyroid gland. Hypersecretion, hyperthyroidism. Thyroxine regulates the behavior of the person in a high quantity of secretion. It enhances the mental activity of a person, changing his behavior. So thyroid gland is also known as a temperament gland. The high secretion of thyroxine is related to exophthalmia, the abnormal protrusion of the eyeball or eyeballs, or Graves' disease and Plummer disease, also called toxic multinodular goiter. Thyroid condition characterized by marked enlargement of the thyroid gland, firm thyroid nodules and overproduction of thyroid hormone.